Hi everyone, my name is Julia Tang and I'm a physical therapist. I'm here today with an exercise progression for people who have had an ankle injury. So if you've just injured your ankle or if you've just sprained your ankle, go ahead and stop and watch my other video here about peace and love, which is the new acronym for responding to soft tissue injuries. And it's also going to take you through some introductory exercises to regain the mobility in your ankle and also some gentle strengthening just to start you off, because this video is going to be about more advanced exercises. If you sprained your ankle or injured your foot or ankle and you're still not tolerating a lot of weight bearing, you might want to also check out my other video here, which was technically made for people with plantar fascia pain. However, it goes through intrinsic foot exercises, which are the muscles in the bottom of your foot and kind of supporting the arch and the ankle as a whole. And those will kind of help you regain some strength from the ground up and really just get the coordination back in your foot. So if you've just had an ankle sprain or an acute ankle injury, go ahead and check out those two videos first and then come on back over here. So if you're still watching, that means you're ready for more exercise. So if you've watched the Peace and Love acronym video, you know that the last E in Peace and Love stands for exercise. So we're going to exercise. I'm all about exercise. So if you're tolerating more weight bearing on the ankle, like you feel pretty good walking around, then we're just going to start strengthening the calf, getting some of that power back into those calves. So we're just actually going to start off here with the single leg RDL. I initially said double leg heel raise, but I actually forgot the first exercise. Whoops. So the single leg RDL is going to be kind of our introduction to leg strengthening, single leg balance, with kind of changing the position of your body, as well as getting some of that actual foot and ankle strengthening here too. So you're going to stand on one foot, on the injured foot, and you're going to hinge at the hips, reach for the ground, and kick your back leg behind you. The goal here is to just try and stay in a straight line from your head to your lifted heel. So I'm fairly flexible, so I can probably reach the ground and keep a nice horizontal line. For people who are less mobile, or especially if you've just had an injury, you might only be getting to like 45 degrees or so, or maybe even less, before you feel that hamstring length limiting you, or you're just having a hard time balancing. So these ones you should be able to do a few sets, like 2 to 3 sets. I would do these on both legs as you get back into it, and depending on how quickly you do the exercise, you might be getting through 5 up to 15 reps before you really start to feel kind of a leg, ankle, calf burn here. Your foot is really going to be working. I'll show you from the front. So as you do these, your foot and ankle are really going to work. You can see a little bit of sway. Tap down for balance if you need to. You can see a little bit of sway in the leg here as you try and maintain your balance. So always tap down if you need to, but as you go, try and use less and less balance support. And the standing leg the knee should be straight but not locked up. So straight and soft. An unlocked knee here. And you should feel a little hamstring stretch as you go down, and keep the hips level so that the glute on this lifted leg is going to be working to really kick that heel back here. Okay? And now we're going to move on to the double leg heel raises. So we're just going to start off nice and simple with a double leg heel raise. And with the double leg heel raise, you want to keep your knees straight for the first variation. And make sure if you need something for balance, you can hang on, but try and really get to your full height here. So you should be able to do a lot of these, like a couple sets of 20 to 30 without getting too fatigued and without getting pain in your ankle. So then the next progression from that is going to be another option to train the lower down soleus. So the straight knee double leg heel raise, it gets more the gastroc, which is the higher up, bigger, powerful calf muscle. So you do a bent knee heel raise and make sure your head actually goes up and down and that you're not just like tipping forward your knees. So your head actually has to go up and down with the knees bent. And this one is usually a little bit harder for a lot of people to coordinate, but this will train the soleus, which is more that endurance muscle in the calf. And again, you should be able to do a lot of these, like 20 to 30, and this should not hurt your ankle. So moving on from that, we're going to do some kind of shock absorption stepping and loading the ankle in different directions. This is going to be a forward lunge, alternating. So you step forward into a lunge, step back. Step forward into a lunge, step back. You do want your knee going a little bit past your toe, just to work on that deceleration, as well as working into that ankle mobility. So if your knee goes forward past your toe, You're going to have to get into some of that ankle dorsiflexion. This is really important for running, jumping, landing, changing directions. So these ones you probably want to be able to do at least 2 or 3 sets of 20 alternating. And this is to get your ankle and your legs really ready for getting back to running, jumping, jogging, things like that. So that's the forward alternating lunge. And then, especially if you're going back to a sport that requires some type of change of direction, you really want to be able to do a lateral lunge. So we're going to do a lateral step out lunge alternating. And you're going to keep the trailing foot flat on the ground. So I do like doing this alternating regardless of which ankle you sprained or injured. So one, as you step out, come back, you get used to absorbing force in that side to side direction, as well as pushing back the other direction. It's not quite as fast as a jump yet, but then also in this trailing leg, we get used to having the foot in that position here, because the majority of ankle sprains or injuries are when your feet roll outward, and so often this is a very uncomfortable position for people who have had an ankle injury. And so this lateral lunge, you can see this trailing leg kind of gets into that relative position of ankle inversion here. So I like the lateral lunge for that one. So if you can do, again, 2 or 3 sets of 20 of these alternating, you're probably in a pretty good spot in terms of side to side shock absorption and production here. Then we're going to come back to the calf. So we're going to do a single leg heel raise. So let's say I injured my right leg. I'd want to at least be able to do 30 single leg heel raises before trying to go back to jogging, because if you think about it, jogging is a series of repeated single leg jumps, and so if I can't even do a single leg heel raise like 30 times, you take way more than 30 steps in even just a minute of jogging. So you want to be able to do a lot of reps of this, and also you want to compare to your other side, the uninjured side, to make sure you can get a pretty similar height and a good number of reps there. Again, you want that to be not super painful here. So again, we can also do the single leg heel raise variation for the soleus, so a bent knee. So this one, I would recommend using something for support because it's usually a little harder to balance here. And again, you want to make sure your head is actually moving up and down rather than just, I'll show you on this leg, it's a little easier to see, rather than just tipping your knee forward. You actually want to be raising your whole body up and down here. So you want to be able to do a lot of reps of single leg heel raises before we get into our next series of exercises, which are going to be some plyometric progressions here. So the easiest plyometric progression, or the easiest little plyometric exercise to get back into, is going to be a double leg hop. So this is just testing out if your ankle is ready and willing to accept a little bit of a bounce, a little bit more impact here. So we start off with double leg because you want to make sure you're having even weight distribution between both feet, and start with a small bounce, and then you can work on getting higher and higher and getting a little more spring back into that ankle. Okay? So then, especially if you're going back to sport, you want to be able to do things in different directions. So pick a line on the ground, try and hop forward and back over it. So this is kind of like when you have to stop or back pedal, change direction, and that should not be painful, and you should be able to do it without noticing you're like shifting all your weight onto the uninjured side. And then again, you pick a different line on the ground, and then we're going to go side to side and make sure you can go over that line. Again, keeping good core control, having nice soft knees, and a good spring from the ankle. So we always start double leg just to build up your confidence, because oftentimes people are a little nervous about going different directions on this newly injured ankle, or if it's a chronic problem, if you've had a history of many ankle injuries, people tend to trust that ankle a little bit less. So double leg is a nice introduction back into things, but of course we always want to level up, so we're going to go to our single leg progression. So single leg hopping, you want to make sure you start small and then try to increase your height and your hang time there. Make sure that's not painful, and I would definitely make sure you can do some single leg hopping before you go back to jogging. Again, jogging or running, same thing. Running, jogging is a series of single leg jumps, so you want to make sure you can do it on the ankle before you actually try and go do it on the road or on the field or whatever. So to progress from that, we can also do the same thing. You pick a line on the ground and try and hop forward and back across it. You should probably be able to do at least like 20 to 30 seconds of each direction of these, to think about returning to a sport with a change of direction or that requires a lot of sprinting. You can also pick the vertical line on the ground and then go back and forth across that vertical line. So just making sure your ankle can absorb force in kind of all different directions here, okay? So that's kind of all a little bit more stationary though. You kind of stay in one spot. For a lot of cutting sports, cutting activities, change of direction, you need to bound from one foot to the other. So that is the next progression, which is going to be a lateral skater. If you've done the lateral step out lunges, you know you have this side to side power to push off. So now you just have to make it into a lateral skater. So keep your body in between your feet. Start kind of small, foot to foot, and then try and increase the distance, and then increase the speed. And again, you should be able to do these at least for 20 or 30 seconds for a couple rounds before deciding you want to get back into practice. And then the last one, probably the most challenging one of this circuit, because it's last, is the agility dot. So this is going to be a single leg hop. You're going in a bunch of different directions. You pick 4 dots on the ground and you go up, across, diagonally back, and then across. And then I usually do like 4 to 6 cycles in one direction, and then I'll try and switch the direction. So say we're starting off on the right foot here. So we're gonna go up, across, back, across. That's 1, 2, 3, 4, 5, and then we'll switch directions. Up, across, back, across. For 2. Try and stay up on the ball of your foot on these. And 5. So for that one, the core challenge is increased because you want to keep your trunk nice and tight. If you're swaying all over the place, it makes it really hard for everything to be controlled down at the ankle level. So that's my exercise progression. If you're trying to get back in the game after having either an ankle sprain or another acute or chronic ankle injury, this is just a nice progression going from kind of more static strength focused exercises to more dynamic things to get you back into cutting and back into your sport. So hopefully that helps you, and thanks for watching.